Hello everybody, I hope you will be better. I hope this is difficult days will end and the war stop and see each other for good and peace. I am محمد الدين اللطيف Ahmad. My presentation is Ringworm. Introduction. Synonyms: ringworm, dermatomycosis, dermatophytosis, trichophytosis. Definition: a superficial fungal disease which is caused by infection keratinized epithelial cell and hair fibers by dermatophytes. It is characterized clinically by circular, sickly areas of alopecia with or without crust formation. Etiology: the causative agents are fungi which grow on the hair or skin or both. In cattle, trichophytin, frocosome, trichophytin, mentogrophitis, trichophytin, mignani, and trichophytin quinam. In horse, trichophytin quinam, trichophytin quantitam, trichophytin mentogrophitis, trichophytum frocosome, microsporum quinam, and microsporum gypsum. In dog, microsporum canis. In this picture you see different trichophoton in A microsporum canis, in E trichophytum quinam, and F trichophytum frocosome. Epidemiology. Description: according all animals species in all countries. Transmission: the spore of ringworm fungi severe for many months and or years in the farm environment. Transmission either by direct or indirect contact of clinically diseases or asymptomatic carriers, asymptomatic carrier animals and asexable host. Indirect contact occurred via inanimate objects, particularly bedding, harness, grooming kits, and vomits. Susceptible host: all domestic animals and humans. Factor 1 influencing: cattle of all age and breeds are susceptible. Young animals are more susceptible. The incidence is more common where animals are housed in a close proximity to each other for long periods. Animals in poor condition are more susceptible than this is in good condition. A high incidence in winter and animals treated with immunosuppression drugs as corticosteroid. Economic important: in the long course of the disease, which is manifested by weight loss and skin injury, and also the disease has public health important. Pathogenesis: ringworm fungi attach chiefly keratinized tissue, particularly the sternum corneum. This is one of layers of epidermis. The epidermis have 5 layers. One of them is sternum corneum and or other name horny layer. The fungi attach this layer and hair fibers, resulting in autolysis of the fiber structure. This causes breaking of hair and alopecia, as well as allergic dermatitis and dry crust formation, which are characterized in the lesion. The lesion will progress if a stable environment condition for mycelial growth exists, such as a humid atmosphere and slightly alkaline pH of the skin. Ringworm fungi are all strict aerobes, and the fungi die out under the crust in the center of most lesions, leaving only the periphery active. The immunity in specific to the fungi species concerned and in horse lasts for up to 2 years. Clinical sign incubation period from 1 to 6 weeks. Morbidity rate is variable, but higher in young animal. The course may extend to 4 months or longer than this. In large ruminants, round and or oval areas of crusting and alopecia that range from 1 to 5 in diameters are the typical ringworm in calves. Common sites in the pericircular regions, ears, muzzles, neck, and trunk. In adult ruminants, the lesions may be anywhere on the body, but often appear on the trunk and neck, in few cases showing the lesions as in the young. In sheep and goat, crusty wart-like lesions on the face and the ears, accompanied by intensive pruritus. In horse, the clinical signs usually being as erythematous follicular papules that progresses to area of sickly crust and focal alopecia. The lesions are usually non-pruritic as a result of mechanical transmission. Lesions are most commonly located near the saddle or tack area. Involvement of the axilla is called great etish. The lesion in different animals in the right and the central in the cat, and the picture is the left, and the lesion in the human. Post-mortal lesions not specific. Diagnosis by file diagnosis by clinical signs and use Wood's lamps to determine the lesions. The lesions appear by fluorescence color. Laboratory diagnosis: specimen, scraping of crust, hair are suckled. Use direct microscope exam of with skin scraping made after gently warming in 10 to 20% solution of either phosphate or sodium hydroxide. Definitive diagnosis by subrods agar and observing which type of fungi in this animal. The different fungi grow in the Sporadis agar and make different colonies. Differential diagnosis: mycotic dermatitis refers to skin condition caused by fungal infection as candidiosis and mengi. The disease caused by parasitic disease caused by different type of mites, and Mucocilious cutaneous infection caused by different microorganisms such as bacteria, fungi, virus, and parasitic, as impetigo, and cellulitis caused by staph aureus and strep aureus, or herpes virus. Treatment. Most cases of ringworm are self-limiting, and the goal of the treatment is to reduce the spread to other animals and the human. The treatment of ringworm including topical and systemic treatment. Topical treatment by removing the crust and washing with soda solution, and use fungal product to decrease spreads, as iodine, shampoo, thiobendazole, dichlorophone, and myconazole. Systemic treatment by sodium iodide and glycoflavin, not used for pregnant animals. The systemic treatment as these two drugs not recommended. We use also vitamin A and D. Prevention. The disease can be eradication by isolation and the treatment of infected animals, cleaning and disinfection of staples with detergent or strong solution. A new SSR, Russia Today, made live vaccine from non-pathogenic strain of trichophoton frocosome, 2 doses, initial doses, and is followed by second doses after 10 to 14 days later. This is my presentation today. Thank you for listening, and goodbye.